So hello everybody, hope you guys are having a good time. So in today's video we'll be talking about this particular lady, a Nigerian lady who is in Australia. She's moved to Australia for greener pasture, but she's going to spend a really long time in jail. I mean a really long time, because guess what, she's been charged with manslaughter. In my last video, I talked about why people shouldn't be making health decisions based on social media posts, based on someone's social media post. I called it the rise of the anti-intellectuals. In the past, we used to have this idea where you would expect someone who is the expert to make every single decision you'd be making based on anything that is very critical. I mean, in some cases, we're talking health issues here. I mean, in the past, you'd expect people to listen to whosoever is their health practitioner, to their doctor, to their nurse, to someone who has been certified to make decisions for them. But these days is actually quite different. I mean, with the rise of TikTok, Instagram, Twitter, and all these things, we've started seeing the popularity of quacks. And these are not just quacks that are like your regular quacks. I mean, these are quacks that are coming on social media to make decisions for people, which these people who we call quacks, I wouldn't blame. I won't blame in any single way. The only people I will blame are people who listen to them and decide to ignore the advice of probably their doctors. Now, what's happening in this particular case? So, the Nigerian lady in question, she's been charged with manslaughter based on one reason and one reason alone. She's been responsible for the unalivement of a newborn. Because of her own decision, because of her social media escapade, a newborn is no longer alive. So let me give you guys a little bit of background about this story. So this lady, what she does is basically she's a midwife, according to the story. She's a trained midwife. So by midwife, I mean people who are like nurse who stays around newborns. They are like obstetric nurse. For people who want to have children, the nurses you see around are mostly midwives. So now, she decided that she's not just going to practice her midwifery in the hospital, but she's going to practice it outside the hospital. And by this, she started to use social media. And what she does on social media is encourage women to not have their children in the hospital, but rather have their children at home. And by this way, I don't know, but in this case, she perhaps charged them a particular fee to ensure that they are not doing that without the supervision of an health professional. And in this case of health professional, she's the one. She'll go to this person's house, help the person deliver the baby, and of course, charge a fee. I mean, in most cases, I believe midwives are competent enough to have babies. But in most cases too, you need the certification. You need a doctor to have seen that patient at some point and make a determination that this particular patient isn't high risk in any way, and I don't think she will need cesarean section or any complicated bed, and she can have the baby anywhere she wants. In some cases, she can have it at home when the midwife is there. She can decide to want to have what they will call a water bath, where you want to have the baby inside water, whatever different cases. But no, you don't want to have a pregnancy that goes through a pregnancy of 9 months without a doctor's supervision, because a doctor is able to do an ultrasound or refer the patient for ultrasound, see some things maybe perhaps the midwives would not have seen, see the risk factor, assess the baby, the woman, and then make the determination that okay, you can have the baby anywhere else, as long as a midwife will be there. But then because of this woman's social media campaign that, oh, you don't need a doctor. Who are doctors? They are fake, quacks and all that. Now a woman decided to trust her and decided to have the baby at home. But something went wrong. And most of the time they say, I say this to people, doctors are not there to supervise every single cases. Doctors are there for that one or two patients when things go wrong. I mean, every life is precious, so we have to take every life as precious, and hence doctors are always present in most cases, because if something goes wrong, we don't want to We don't want a situation where someone is no longer alive because one person isn't around us at that point in time. In this case, a woman decided to have a child at home, and something went wrong, and the only person present was this midwife. And when the investigation was done, it was determined that at some point during the delivery, this midwife could recognize that this woman was in distress and this woman should go to the hospital or perhaps call the ambulance, but she had not made that decision. She had decided that it's fine, you can keep having this baby, and eventually the baby packed. Now she's been accused, or she's been charged with manslaughter. I mean, like I've said before, people should stop making health decisions based on social media posts. This woman on her social media, what she does is encourage home delivery. People can have your children at home and all that. And in this case, she's landed herself in trouble. But unfortunately, like I said, this video isn't about this woman who is landing herself in trouble, but rather the person who decides to believe her story or believe what she says on social media and make a decision based on what she's seen on social media. And also the unfortunate case of a baby who probably would have gone ahead and lived a very good life, now no longer alive because the parents decide to make that decision at that point in time. I mean, like I said originally, you guys should stop making lifelong decisions based on someone's social media post. You guys tell me what you think about this topic of people making terrible decisions all along every single time. I'm BY, and I'll see you guys another time.